very much. I'd bring it to Sarah Owen now.
Thank you, and thank you, Secretary of State. At the last meeting of the Health Select Committee, I asked 3 times about guidance for pregnant healthcare workers. As you've just said, we've now tragically seen the death of 28-year-old Mary Aguiar-Agupong at Luton and Dunstable Hospital in my constituency. The current guidance on pregnant healthcare workers during this pandemic comes not from the NHS, but from the Royal College of Midwives and from the Royal College of Obstetricians and Gynecologists. And if I may, it states, it may not be possible to completely avoid caring for all patients with COVID-19. As for all healthcare workers, use of personal protective equipment and risk assessments according to current guidance will provide pregnant workers with protection from infection. The arrival of rapid COVID-19 testing will significantly assist in organising care provision. And this guidance will be updated appropriately when tests are commonly available. Now, despite continual promises to ramp up the distribution of PPE and testing, healthcare workers on the front line have been left wanting. So will you commit to ensuring that there is a review of the guidance for pregnant healthcare workers in light of the delays in PPE distribution and testing being a long way off commonly available? And will you commit to seeing that revised guidance coming straight from the NHS and government?
Well, there's several things to answer in that question, Sarah. The first thing is to say that we work very closely with the Royal Colleges, and whether guidance comes from the Royal Colleges, Public Health England, or the NHS, we try to ensure that guidance comes from the most appropriate body for that particular group, and we work very closely together. So whether guidance comes from the Royal Colleges or from the NHS is much less important than what the guidance says and what the situation is on the ground. With respect to your constituent, Mary, her death was incredibly moving, I think, to so many people, not only in the NHS, but across the country. As was made public at the time that her death was made public, she hadn't been in work for a month. And but we look into every single death of somebody who works in the NHS to make sure that we fully understand it. So making sure we get to the bottom of each and every one of these cases is incredibly important. And that also includes, the access to the protective equipment, of course, and testing. So finally on testing, we've now made testing available to everybody who needs it across the NHS. So all staff who are symptomatic now are able to get tests. And I can tell you that over 50,000 people who work in the NHS have now had tests. So the good news is that we're able to expand, because we're expanding the capacity to test, therefore we're able to expand the number of tests that are done, not only on, for instance, patients going to care homes, as I announced earlier this week, but also on for NHS staff and members of their households, if a member of NHS staff is isolating because of household isolation.